Good afternoon, Baltimore, and everybody watching online. Welcome you to this lunchtime chat. My name is Kelson from the AM Click.
How you doing? My name is DJ Flo, also from the AM Click.
And today we're ready to have this real conversation because, Flo, we know you like to be outside.
Yeah, I do like to be outside.
A little bit.
Don't just leave it up to me. Everybody likes to be outside.
But it's a question that everyone has asked at some point: is the pandemic over? You know? And
so
thank you.
We know.
To Johns Hopkins Medicine for making this happen. We got some very special guests, some official guests who actually know about the whole coronavirus and what we can or what we can't do. So we're going to allow them to do their job and not make up stuff in our own head or, go off of comments on social media, right?
Absolutely.
So let's start and bring our guest to the stage. Our first guest is Dr. Sherita Golden. She is the Vice President and Chief Diversity Officer for Johns Hopkins Medicine. She's also Professor of Medicine at Johns Hopkins University School of Medicine. Dr. Golden, good to see you.
Thank you for having me.
Of course. Our next guest, Flo, you want to introduce our next guest?
I knew you was going to leave it up to me for the names. Can I go with, I want to bring my guy up here. Co-Director Medicine for the Greater Good, Johns Hopkins Bayview Medical Center, Assistant Professor of Medicine, Johns Hopkins University School of Medicine, Dr. Panagis Galiatsatos, a.k.a. Dr. G.
Good job.
Perfect. Thank you, good sir.
Dr. G, good afternoon.
Good afternoon.
And last but not least, Dr. Lisa Maragakis. She is the Senior Director of Infection Prevention at Johns Hopkins Health Center. She's also the Professor of Medicine, Johns Hopkins University School of Medicine.
Hello, thanks for having me.
Of course, thanks for being on here. So, as DJ Flo and I were saying that ever since March of 2020, everyone has been asking, is the pandemic going to be over? Some people said, in 10 years from now. Some have said 3 years from now. But today, we are going to ask you all the questions that hopefully people can get real answers from, so you can stop guessing and looking at the comments on social media sites. So I think let's start it off with this. Mask mandates are lifting. So is the pandemic over?
So I'm happy to start with that one. So the fact that mask mandates are lifting is not a sign that the pandemic is over. What it's a sign of, and Dr. Maragakis may be able to comment a little more, is it's really a sign that some of the transmission rates in the community are much lower than they have been in the past. So, some of the mask mandates will be rolled back as community spread significantly declines. That being said, I am a firm believer that if you are in crowded situations where you're unclear about the vaccination status of other people, those are situations where you should still feel compelled to wear a mask. And I will tell you that I keep masks in my car, in my purse, wherever I am, because if I'm ever, and even around my neck on a chain, because if I'm ever in a situation where, I'm like, there's just a bit too much activity here and I'm really not certain, then I will flip my mask back on in a minute. And I will also share that my parents are in their mid 80s. So as one of their caregivers, I'm very concerned about making sure they stay protected. So in most public circumstances, I'm still wearing a mask. And I'm interested in my colleagues' perspective on that.
I think you're absolutely right. What Dr. Golden outlined about the fact that the pandemic is not over. We all want to put this whole episode behind us, but unfortunately, we probably have a few more. I won't even venture to say how much longer, but this virus clearly isn't completely finished with us yet. But we see these restrictions rolling back because, like Dr. Golden explained, the viral transmission is less now than it had been before. And we know how tired everyone is of doing all of these things. But it is so important that we remain watchful, vigilant, keep an eye on the data so that if a time comes where there are more cases and the risks go back up, that we know what to do. That's the good news. We've learned so much during the pandemic. We know that masks work, that washing your hands works, and then taking very simple steps like avoiding indoor crowded sites, particularly when there's a lot of viral transmission going on. We're lucky right now, it's lower. And at least for a while, we had better weather where we could do things outdoors. Hopefully that'll come back soon.
Yeah, no, I'll go. I agree with my colleagues. And the bias of all this conversation, by the way, is that I'm a lung doctor. So my patients have made wearing face masks cool before the pandemic, right? They were always wearing face masks in order to prevent their lung diseases from ever getting from getting worse. We know patients that suffer with asthma or cystic fibrosis or other lung diseases, infections always knock them back. So these patients were always wearing face masks to begin with. And for many of my patients now, that's the emphasis I make the case to recognize that the pandemic is here. When we see a surge or an end of a wave, that shouldn't be misconstrued as an end of a pandemic. Just as Dr. Maragakis and Dr. Golden said, we're seeing low amounts, but it's still the pandemic. It's just at the end of a wave. And so if we don't want to see another surge, it's really up to us to make sure that we do everything we can to not catch it. And face masks, I agree, are so important. And it's one of the things I tell my patients. It's one thing I tell the community. Having an inconvenience of a face mask by far outweighs the disruption we would get by shutting things down and so forth. So, just recognize not catching it will help us get to the end of the pandemic sooner than later.
Speaking of surges, we've seen them say in some countries and even in California where the surges, of this new variant, is that as transmissible as some of the other variants that are out there that we should be worried about?
Yeah, this latest surge that we had, really the world over, was caused by a variant called Omicron. And now the most recent one that everyone is watching is a kind of a sub-variant of Omicron that's called BA2. And the percentage of the infections across the United States that are caused by this newest version, or BA2, is rising. And so we're watching that really closely. And each time one of these new variants comes along, we have to learn about it and learn how sick it makes people in general and how easily it passes from one person to another when someone's infected. This one looks like it is very transmissible. So it can go from person to person quite easily. But like we were saying earlier, thankfully, the overall numbers are low right now. And so we'll keep watching and need to respond as the data changes.
I also think an important thing about the variants that we've had to date is that that the vaccines that we have were still effective in preventing serious illness, hospitalization, and death. So, in thinking about the Omicron surge, as terrible as it was, part of that is because we had gathered for holidays, people were gathering in groups, taking off their masks to eat. But the majority of the population was vaccinated. Had people not been vaccinated, we would have seen so many more deaths. So our hospitals were overwhelmed, but it wasn't as much in the ICU, and there weren't the deaths that we saw with previous waves before more of the population was vaccinated. So we are blessed to this point that the vaccines we have are still effective against the variants, but I keep reminding the community, if you aren't vaccinated, you need to get vaccinated, because at some point, what we don't want to happen is for there to be a variant that's no longer responsive to our current vaccines. That would really set us back. So the less transmission we have because of the more people that are vaccinated, then there's less opportunity for the virus to try to change its colors again, change its spike protein, and try to escape our vaccine.
Okay, Dr. Golden, first off, you have an idea that I think you should implement the chain with the mask thing. I think you have a business. I think you have a good business on your hand there. But we have a lot of different mask mandates and different rules being changed left and right. And me, I'm not as smart as you guys when it comes to things like this. I would like to know from your guys' perspective, what is the reasoning for these different changes in mask mandates and lifting? And 1 minute you need the vaccine and a booster to go to work, then the next minute you don't. What is the reason for all of these changes?
I can start, and then I hope my colleagues will join in, because this is a complicated question, and it's one of the things that I think has caused a lot of criticism and a lot of confusion and fear, unfortunately. one factor is that we are learning all together. We have learned about this new virus. No one had ever seen it before. And so now we're 2 years in, so we've learned a lot. But you have seen things change, recommendations change over time because information changed and we learned more about the virus. And then, as we were just discussing, even the virus has changed, and we've seen different versions of it coming and going. But there are other factors in the complex world of trying to take that scientific information and then make public policy from it. So I don't know if Dr. G or Dr. Golden would like to speak to that piece of it. It's complex.
Yeah, no, I agree with Dr. Maragakis. One thing I'm hoping everyone understands is your physicians and your scientists, we're learning in real time about this virus. It's not like I grabbed my medical textbook and flipped to page 252 and I said, let's talk about COVID-19. We learned in real time. So the way we approached this 2 years ago was at the most extremes, of course, right? Because we didn't know a lot about this. I remember coming home, taking countless showers so I wouldn't infect my family. We just didn't know. There's so much unknowns. Now, 2 years into it, I think, as Dr. Maragakis and Dr. Golden emphasized, we know so much about this virus that while it may cause some minor inconveniences, it doesn't have to disrupt our lives. And knowing that we'll get surges up and then they'll come back down, I agree. Like, we have to recognize there's different strategies during those moments. And the only way we know of those moments is the data we collect in real time. So there's a lot of science that helps us kind of live our lives comfortably. The conversation about mandates and not, I think that takes a different context of also kind of the notion of, politicization and so forth. But from our standpoint, as scientists, as physicians, we want what's best for everyone. And our job is to promote health. And I think the best way, vaccines help, but still number one emphasis should be on not catching the virus. And that's why you hear us saying we still support the face mask. So while it's not a mandate, it should be a conversation to have a private conversation about why it's appropriate for you to wear it.
And I think the key, I would say, during what we've had to do in the last 2 years is remain very flexible for the reasons that my colleagues just shared about. As we learn new information, it's not a sign that, people will say, oh, I told you they didn't know what they were talking about. It's really, it's not that. It's like, oh, we've learned new information. So now we know this is safe to do. This is less safe. Because remember, 2 years ago this time, we were all locked down in our houses, and if you remember, we were in a state of emergency across the state of Maryland. Like, you couldn't even be out driving in your car without a valid reason. So, and now 2 years later, we've been able to really gain some flexibility. So I think we have to be flexible and be willing to change as the circumstances change. But that is not a sign of not knowing. It's actually a sign of acquiring new information.
Okay. Got a question from Tia White. Saying the fourth vaccine booster, is that a yearly booster? I'll start with Dr. Maragakis.
This question about the fourth booster is a burning question that a lot of people have. And I will say that we don't yet have a formal recommendation about this. But I'll tell you what we do know. What we do know is what Dr. Golden said earlier, and that is that vaccines are incredibly helpful to protect people. Even though sometimes you can still get the virus, what we do know is being vaccinated protects you from getting severe illness, from ending up in the hospital and dying, unfortunately, as so many people have from this virus. The boosters come into play because we know that even though the vaccine teaches our immune system to fight the virus, that effect seems to go down or decline over time. And we're not sure exactly how far out, but a number of months later, you're going to be less protected than you were shortly after getting the vaccine. And that's where the boosters come in. So I would encourage everyone who's eligible to get a booster to get a booster. And then this question is about the fourth shot. So if you've gotten the 2 initial ones and a booster, should you get another one? And that's where some people, particularly those who are older individuals or who are at highest risk for severe disease, are asking this question. Maybe they got booster right when it became available, and now we're about 4 or 5 months later. Should they get another one? The FDA is currently considering this question, and we think that within maybe even this week, we might hear a recommendation about certain groups that would be able to get that 4th shot. If that information comes out, then I would say go for it. If you're in one of those higher risk groups, get your whatever recommended booster that you're eligible for will really protect you.
Okay.
And we don't yet know the answer to the second part of the question about whether it'll be yearly. We just don't know, and that's part of that learning. It's been 2 years. That seems like an awfully long time, and we're all tired of all of this. But it hasn't been that long since people have gotten boosted the first time. So we don't yet know how long each booster will last.
Okay. With the free flow of the internet, everyone is able to communicate with each other at a fast speed. So those are pros and there's some cons. The cons, of course, is the spread of misinformation everywhere. So I've seen tweets, Facebook long messages, and stories about people saying that they contracted COVID, and because of that, they were able to create some form of immunity to the virus. I want to know, how true is that, and what are some misconceptions do people have about that idea? Like, if I had COVID a bunch of times, am I immune? Should I still go out and grab extra boosters, or am I good?
Yeah, that's an important question. So when I was a little girl, and I won't say how long ago that was, I did have a birthday last week, but it's irrelevant. They used to have these chicken pox parties, where it's like, well, you know what? Since one person in the preschool got it, we're just going to let them all play together and get the chicken pox, then they'll be through the whole class.
Wow.
We do not want to take that approach with COVID-19. So, there is this question about, well, I've gotten COVID, or I got my first 2 shots, but I haven't gotten a booster. Should I just go and try to get COVID? And then I have super immunity. And we don't want to do that, because remember, what we're still learning is what are the long-term effects of COVID. So there's something called long COVID that you may have heard of, where people are still having trouble with breathing, trouble with their heart, trouble with their physical, endurance and energy months and months and months after getting COVID-19. So because we don't, and there's a whole NIH study that's looking at people and evaluating what causes long COVID, who gets it. So you do not in any way want to get COVID to get super immunity, because you don't know what else you're inheriting. So if you have had COVID previously, a mild case, you still need to get vaccinated to avoid getting a potentially severe case, or having long COVID, because long COVID isn't necessarily linked to how severe the case of COVID was. So that's one reason why we're still encourage the vaccine and the booster, even in those who've had COVID before. You don't want to get it again if you don't have to.
And if I can continue adding to that, I 100% agree with my colleague, Dr. Golden. The benefit you get with the vaccine is that, we've studied it. We evaluated it on 50,000 plus patients, depending on which vaccine you opted to get. And then we continue monitoring it, right? It's kind of like a recipe. We know exactly what you're going to get. So we continue being able to tell our patients what they're the benefit they're going to get, and, any side effects. If you roll the dice with, a natural infection, we really don't know what's going to come of it. And I'm a physician who's part of the 3 doctors that oversee the post-COVID-19 patients in our clinic. I can tell you these patients, if you talk to them, they'd rather have COVID than post-COVID any day of the week. Post-COVID destroys people's lives. It may not take it away, but it really destroys their lives. And the majority of those patients, mild cases, and were young. So as Dr. Golden said, the vaccine, it's like, anything else that's man-made, right? We give you the confidence, we've tested it, we know exactly what we're going to get. It's meant to protect you and save your life if you should catch COVID. I wouldn't rely on Mother Nature, because she's not pro-human, as you can tell. She's got other reasons to do us in. So from my standpoint, the vaccine by far is the best way to get a defense against COVID-19.
Ever since the shutdown began, we were locked down, stay in your home, don't go around people. But now, as the numbers are beginning to go down, some people want to get back out to some normalcy. But even myself, I'm still a little anxious about going certain places, doing certain things. How do we deal with, getting over the anxiety, and how do we know what to do, what's safe or not? Because we're gonna be around family and friends and stuff.
I agree with you, Kelson, and I am nervous too, I have to say. And I'm like Dr. G and Dr. Golden. I still have my mask close at hand. So, exactly. So I think we need to remember what works and what all of those infection prevention measures are. And each person has to assess for themselves how comfortable they are. Also, what kind of risk are you at? I notice, the young people in schools and in college, I think, are more comfortable getting back to normal than perhaps some of us who have been around a bit longer and might be at higher risk. And then there are many, many people who have medical illnesses that put them at higher risk for severe disease if they were to get the virus. So I think individual choice here is a very important thing to kind of know how much at risk you are, and those who are really close to you. Dr. Golden mentioned earlier her elderly parents, and I have my elderly parents, and I'm very close with them. So, we need to think not only about ourselves, but about others. And the things you can do about it, I think, are to get together with those whom you know are also being careful. And often that is expanding your group from beyond those in your immediate household to other members. It may be your family, it may be your friends, maybe colleagues, those who are, being also cautious and with whom you feel comfortable gathering. And then that you'll start feeling better, I think, about getting back to normal. And don't be afraid to wear a mask. One thing I have to say is that we have found during the pandemic that whether you do wear a mask or you don't, there's a large pressure that we feel when we come into a room. If we're the only one in a mask, that feels bad. If we're the only one out of a mask, that feels bad. So we need to support each other in our choices too.
Yeah, I was going to say we talk about no judgment zones, and I think that it's really important to allow people to do what they feel most comfortable with without there being judgment. And so, I've been like the only person in my nail place with a mask on, and it's so funny. I've gotten so used to wearing one that like I don't even notice that it's on most of the time. And then you can make it fun. I now have masks in different colors and shades and things, but but the reality is, I have a 22-year-old who's a journalist, so he encounters a lot of people. He still wears a mask because of his grandparents, right? So that's the other thing to think about. He would likely be fine, but he has constantly been thinking about, okay, my grandparents and the other people that they're around who are also older. So it's really not just about our own decisions, as Dr. Maragakis said. It's about who else do you love in your circle that you want to protect. And that way, if someone's coming at you because you're wearing a mask, you're like, but I'm showing love. I'm my brother's keeper. And that really should be a no judgment zone. And so we have to support each other in that, not question or judge people for the decisions that they make.
Like I know for me, even in the studio, I'll have my mask. Now also, I have a 4-year-old daughter who can't get a vaccine. I'm keeping my mask on wherever we go as well. So.
Yes.
It's nice. So I'll be outside sometimes. I like to.
A lot.
I like to go to the movies. I do it in movies and different, arcades and stuff like that. So I speak to people around my age. I'm 33, so people around my age, like I said, we share a lot of information, especially on Twitter. Twitter is one of the biggest things where you can speak, and a lot of times people, I don't want to force it on anyone, but I at least want to be able to give them information. For the person who doesn't get the vaccine or the person who is not interested, are there any other ways that they can protect themselves or make sure that they're good against this virus, Dr. G?
Yeah, so I love this conversation because we have it a lot, especially with my colleague, Dr. Golden and I, and Dr. Maragakis. We've gone out and had these conversations. And this is how I take a step back and say, we're in a pandemic. What role are you going to play to help us end it? right? To me, I say ignorance is not a strategy. If you're drowning in the water doesn't care if you believe it or not, it'll still make you drown. So ignorance isn't a way out of this. So I always put it in that standpoint. Like, what are you doing to help us end the pandemic? You know, the reason why we make such a point of the emphasis with the vaccine is it keeps you, if you catch COVID, a very transmittable virus, keeps you from needing a hospital or intensive care units. It keeps you safe. With that said, there's other strategies as well, such as not catching it, right? Face masking and so forth. So we would love everyone to be, to take on these measures, but I always take it back to them and say, well, what role are you playing to end the pandemic? Because if it's ignorance, that's not a strategy, and that doesn't help anyone out, right? And so I want to hear what people say. And usually with those conversations, we do win people over saying, oh, I guess that makes sense of why I should get the vaccine. From my standpoint, it's just taking it to that human fashion. As Dr. Golden was saying, like, be your brother's keeper. Like, no one is selfish, right? We're all here for each other. That's why we love going. You got to tell me what arcades you're going to, by the way. Here in Baltimore, I don't think it's been an arcade system in a while. But that's it. I mean, it's just taking it back to the basic level of humanity. How are you helping everyone else out?
I think the other thing I would add too is the rules about being able to take off masks in certain situations and those kind of things, that's really for vaccinated people. I mean, so for unvaccinated individuals, everything that we started doing the last 2 years, staying 6 feet away from other individuals, the hand hygiene, they should always have a mask on, because if you aren't vaccinated, you are not protected at all. So we're back to, you're sort of behaving in the same way that we were in March of 2020. So that's the other thing that is very interesting. Don't be lulled into thinking because certain guidelines have been rolled back, it applies to everybody. Those guidelines are typically applying to people who are vaccinated. But what I've found in the community is even people who aren't vaccinated will behave in the same way. And that's how those are the people, when we saw the surge with Omicron and the like, those were the people that were the sickest. It were those who were either unvaccinated or they had some type of condition, like with their immune system not responding, that made them not respond to the vaccine. But the unvaccinated in a surge are going to be those at the highest risk of severe illness and dying. So, again, those sort of, when you're talking to the folks at the arcade, and I haven't been to an arcade since there was Pac-Man, I'm probably telling my age with that one. But, those rules are really for people that are vaccinated. For people that are unvaccinated, they're still at the highest risk and need to be doing all the things we were doing, pre-vaccines.
So what about, I'm sure we've all seen this on social media, or definitely doctors, you definitely have, people that's been vaccinated, got boosted, but they still got COVID. So they're asking, are these vaccines really working?
Yeah.
Such an important question. That the short answer is yes, they are working. And every day we get more data about how effective they are. And so, I think it's important to know that the vaccine is really most effective at preventing you from getting severe illness. And as Dr. G said, landing in the hospital on a mechanical ventilator in the intensive care unit, or heaven forbid, dying from the virus. So that is the main effect that we know. And then the second effect we've discussed earlier today is that it helps. If you're vaccinated, it helps prevent, it dramatically reduces long COVID. It helps to prevent those terrible, long-lasting symptoms that people are suffering, many people are suffering from long after even a mild illness, if they got the illness before they were vaccinated. So yes, the vaccines work. And unfortunately, I mean, we have to admit what they don't do. What they don't do is completely keep you from getting the virus, but they protect you once you do get the virus.
What I will add to that is I always like to tell people, like, you've got to think of the vaccine like a bike helmet. It doesn't prevent you from falling, but if you do fall, you're not going to get severely ill. That's the intention of the vaccine, right? So if you're going to get the shots but still go out to public settings without face masks, yeah, you're setting yourself up to catching the virus. It's like wearing a bike helmet and going through the rockiest, hike trails and so forth. You're setting yourself up to fall. So the intention of it, as Dr. Maragakis said, to keep you from having severe COVID. So not catching it is a very different strategy.
Dr. G, you have some great analogies. That was your third one. I'm counting. You got some great analogies. So a question I want to ask is, I have two nephews, one 9, one 5. And we ask this question all the time. Are vaccines safe for children? Should children go ahead and go get vaccinated? What should we do about people with young kids in this pandemic?
Yeah, I would say the answer to that is yes. I have a cousin who is a 5-year-old and, reached out to me about the same question. And, one of the important reasons so now children ages 5 and over can be vaccinated. Those vaccines have been shown to be safe and effective. And, one of the things that's important there is, children were sort of like, they were sort of like a sort of a pool, if you will, of ongoing virus. They may have mild or asymptomatic, illness without symptoms, but then they go home to their grandparents, they go to visit grandma, grandpa, and then suddenly they've passed it on. And now, grandparents are like really sick and hospitalized. I mean, that was the other thing with the Omicron surge. We had the holidays, people came home from college, kids had gone back to school. So that way, if we get them vaccinated, number one, again, we don't know what the long-term effects of COVID are. So you definitely want to prevent as many children from getting it as they can, because we don't know what long COVID looks like in children versus adults. But then again, so that they can't be a vector and pass it on to others in the community who are less protected.
So what do you say to people who don't want to get the vaccine? They're like, well, when I was growing up, these other vaccines for like the chicken pox and mumps, rubella, and all those, they've been tested year and years, years of testing. So why should I trust this vaccine that's been working for what, three or 4 months? I'm exaggerating, but not as long time that it's been tested. Like, what advice? What would you tell them? Why should they trust this vaccine?
I'll jump into that one, and I'm going to come at it with 2 approaches. One, we have to be mindful that COVID-19, we keep saying that because it's easy to say, but that's the disease by the virus SARS-CoV-2, right? So there's a sequel, right? And what I'm alluding to is SARS-CoV back in the early 2000s. There were other strategies around that time to help fight that virus, and one of them were vaccines. So meaning we've had about 20 plus years, and Dr. Maragakis could probably fill that in a little bit more, but 20 plus years of insight into how to create a good vaccine against coronaviruses. We got hit with MERS-CoV in the mid-2010s. We've been dealing with coronaviruses for quite some time. Recently, we just got the pandemic. So what I'm alluding to is we've had decades of experience of this virus in order to create a good vaccine for it. But there's another thing that happened during the pandemic that, to me was part of a silver lining, if there can be some good outcomes. And it was a recognition that we just let science work at its pace. With all those decades of insight into these coronaviruses, a lot of man-made barriers were removed, like the economic cost, because usually these companies need to get grants in order to get paid and move forward. No, everyone chipped in. A lot of people stopped what they were doing in their labs and they just focused on, creating a COVID vaccine. So you saw science work at the pace when you removed a lot of man-made barriers to get to the vaccine. So from my standpoint, yeah, you should trust this because we've had decades of experience with coronaviruses. In addition to, we just moved at the pace of science. And last part, I'll say this is an analogy, so no worries there. But keep in mind, there's so many of our grandparents walking around with that smallpox scar, when they stepped up to get something to end a virus that plagued us for 3,000 years. And many of them will tell you they did it because the only thing that was told of them was it won't infect their next generation, right? They stepped up to make sure that they could put an end to something that's been plaguing human beings for 3,000 years. The trust there was because they trusted the community that came in to give it to them. But I say this because while we should have a healthy dose of skepticism, we shouldn't trade that for trust in humanity, right? We're trying to end something so we can live our lives, just like our prior generation did for us with smallpox.
Yeah. And I would also add that, the technology that was used that we are using in the mRNA vaccines in particular, was developed over the course of 10 or 15 years, specifically in case we ever found ourselves in the situation we're in today, that they would be able to very quickly make a vaccine. And that's what's really key is that, it was projected that this could happen. And when it did, we already had the technology in place. And sort of to what Dr. G said, is being able to also funnel all the resources so that as the first phase of the trial looked promising, they started the second. As the second looked promising, they started the third. So it was really like putting money and investment up front, from the government and from industry, because so many people were dying globally at such an alarming rate. So, it's really a model to think about. If we did that with other things, we have other pandemics, all of them not infectious. There are other things, if we could use that model now and translate that to other things, we could solve a lot of the public health crises that are going on.
That is so true. And I would just add that, we did know a pandemic was coming. We can look back in human history and see that they periodically come. And so we're learning lessons from this pandemic, and we'll aim to, as Dr. Golden just outlined, be even faster next time, hopefully. So we learn from each one and do a lot of work in between, preparing so that we are as ready as we can be when a new pathogen like this comes along.
I saw, I remember, if I can remember clearly, in 2014, Barack Obama actually had a press conference where he warned the entire U.S. about we're not prepared currently right now if an event, a pandemic happens, and then you fast forward 6 years and then boom, he kind of warned us on this. I know this is not a question on a piece of paper. But I would like to know, you guys being in a position of power, what would you guys do if you guys were like the president or vice president or sitting in that chair? Like what would you guys have implemented early so that we could stop this from the next pandemic 30, 40 years, 50 years down the line?
Maybe we should each answer, because we probably would have different answers. The combination.
Yeah.
President Golden, you're first.
Okay, so I think so. Interestingly, when this pandemic hit, so in my role at Johns Hopkins Medicine, as the pandemic was evolving, part of my role was to lead our organization's response, but from a health equity lens. How do we make sure that vulnerable communities are not being left out of testing, of vaccination, of other things? And sort of thinking about what should our organizational response be, there was actually a national sort of pandemic advisory group that was convened by the Office of Minority Health right after Hurricane Katrina and before the H1N1 influenza pandemic, which happened in 2009. And they basically outlined strategies to, like, how do you support vulnerable communities with the pandemic? And essentially what we needed to have done, which was what was outlined there, is you need to actually address the lack of adequate sick leave in on certain jobs that are considered essential during the pandemic. So if you think about it, a lot of the marginalized communities that were adversely impacted initially had jobs that were considered essential. Those jobs may or may not have had adequate sick leave. So if you've got to quarantine for 10 days, but the 10 days you're off, you're not getting paid, that creates an economic challenge. We should be addressing housing insecurity so people aren't living in crowded multi-generational housing, because part of, like preventing the spread of H1N1 back there was people needing to socially distance. Some communities could not. So when you think about it, it is actually our economic, our housing, and our employment infrastructure that I would have worked on making changes to. And this is what we need to think about now. Now we know what happens. We should not be in this situation again. How do we take what we've learned about how to prevent the spread of COVID from an equity standpoint? And then that becomes a part of our normal operations. So if there's another virus, then we know, okay, we have a way for people to socially isolate. We're going to figure out a way to have them have, their pay while they're having to quarantine, so that people don't continue to go to work when they're sick because they don't see any other way. How do we ensure adequate access to healthcare and insurance? Those are the kind of things. And that not only helps for, what I call the infectious pandemics, but we have chronic disease pandemic in many ways. And those are the diseases that made people at higher risk of dying from COVID-19. So those are some of the things that, that I would have put in place, and I think we can put in place moving forward.
That was perfect.
Thank you, Dr. Golden.
She's ready for presidency.
I elect you, Dr. Golden. Well, that is, I think, one of the most important points. And as Dr. Golden said, it applies not only during a pandemic. We saw it during the 1918 pandemic and probably every pandemic, but also in between times with health disparities. So that is definitely something that we have to address. I would add two other things. One of them is about supply chain. So one of the first things that we saw break down was the availability of what we needed in healthcare, and also what everybody needed, everybody, to fight a deadly virus. And one of the simplest things was alcohol hand rub, and it became just impossible to find. We didn't have any in the hospital. No one could get it at home. Disinfectant wipes weren't available. And, it's just almost unimaginable to confront a deadly virus without being able to clean your hands and clean the surfaces. And in healthcare, we didn't have, gowns and gloves and masks, and everybody needed these things simultaneously. So, I thankfully have never been a president, and I know it's a very tall order, but anything we could do to organize ourselves as a country, as community, as a world, to make sure that we put all of our time and energy into making the things that we do need to confront the threat that's there, I think is important. And then the other thing I was going to mention is testing. And we still need this. It wasn't available at the beginning. We've struggled with it throughout the pandemic. And we still just don't have widespread availability of rapid result tests that are good tests. And that's one of the things that can empower individuals to make the right choices, because we all have allergy symptoms or a little sore throat or something here and there. And you need to be able to test yourself frequently and say, is this COVID? Is it COVID? And make choices about where you go, who you're with, based on that information. And it's just still, I think, too difficult to get a test.
What I will add, to these comments is actually a different perspective, in addition to everything they said, but it's medical messaging, right? You guys commented appropriately about so much misinformation that's out there. And my frustration with that is every time I hear about the misinformation, I feel like we, as a medical society, have let the community down. We should have always been out with the community, talking to them about health, about wellness, not just in times of the pandemic, right? Where I promise you, when I've gone out into the communities, many of them would say to me, why are you coming to us now? Where have you been before the pandemic? So these communities then are going to listen to misinformation because it's usually coming from trusted sources, and it's in a narrative that's easy to understand. I think it's such a huge failure on our standpoint to make sure that healthcare systems always feel part of the community, not just when we need them to help us end the pandemic. So one thing I would establish is, communication offices and people to go out there, sit in the PTA meetings, sit with the worship services, just listen to what's going on with the community. That way, when we do need the community to help us end the pandemic, because that's where it ends. It doesn't end in my ICU, right? In my ICU, that's a whole different strategy. The pandemic ends out in the community, out in the neighborhoods. And so we need to establish a better communication. That way they feel like the hospital is there to serve them and not be served to.
I enjoyed those answers. And the reason I want to bring that up, and the reason I want to bring that up, because I just want to have a transparent, just a direct line, because I think a lot of times people know about the pandemic and being affected and make doctors like a bad guy, or like Dr. Fauci or the government, like it's us versus the health officials, and they don't know the disparities you guys have to deal with, the lack of resources you guys have, the lack of information you guys have. So I think if the average person knows that the doctors are kind of figuring this out as well, and we're trying to do this without gloves and without our materials, then everybody can kind of, let off the gas a little bit and kind of be a little more empathetic to each other. So I appreciate you guys for having those answers. Kelson,
That's so important. Can I just say, I keep saying for the last 2 years, we're all in this together. And it really pains me how much conflict and infighting has happened. So Flo, I think that was a very important point.
Well, I have two questions. The first one, I'm going to ask Dr. Golden. Dr. Golden, can you please confirm that, yes, COVID is here, but the common cold, the flu, and allergies still exist?
Yes, let me confirm. So one of the other reasons I will share that I still like masking is because I have actually been the most well in the last 2 years as I have ever been. I mean, I used to get like some kind of nasty cold flu thing, like every year. So one of the things that we saw last winter is there was almost like no influenza. Like there was almost like no flu because people were wearing masks and they had really good hand hygiene. So here's the reality. You can like get your COVID-19 vaccine and take your mask off, and then like the common cold and the flu can still happen. And when you take your mask off, then the pollen can get up your nose. So I'm just from a practical standpoint, we can sort of remove some of the confusion, particularly when we're in crowded spaces, by wearing a mask, because remember, you're also blocking out other viruses, and in the flu, honestly, the flu was previously like that was our most deadly virus, that would come in like waves. So, we have to remember that the flu is still here. I mean, I have family members, they were all for the COVID vaccine. Oh, but I'm not getting the flu shot. Now, I was kind of like, the shaking my head emoji. I'm like, no, you need them both because the coronavirus vaccine is not going to protect you against the flu. But yes, those things are still happening. So again, it complicates the picture. And many of us have gotten the free at-home rapid test, but to Dr. Maragakis' point, there's not that many of them. Like there's 4 in a family, so you really have to be selective till we have more. So those things are still here. We have not eliminated those other things by the vaccine so.
And I have a question for the floor, my real question. So if someone who may have different illnesses and they can't get the vaccine, are there other like preventions available to help keep them safe other than like wearing a mask? Like, is there anything else?
Yeah, I mean, from my standpoint, I would, it depends like how to perceive this. Like, if you want to avoid public gatherings, yeah, that could be one way to not catch an airborne infection. The intention of the face mask is really to prevent that. And I promise you, I have patients who are operating with 20% of their lung capacity, and they wear masks just fine, breathing okay. So, it's all about how do I not catch it? Well, how do you not catch it? You don't go out into public gatherings. We don't really see people. So I wouldn't really suggest that, right? That takes away a lot of the humanity that makes us people, is those social interactions. So what I would always tell patients is there's always going to be some way, shape, or form of wearing a mask that will always help. And that's what I would always advise, to see if we can find something that's good fitting for you. But from my standpoint, that's the strategy still from not catching it, is being conscious you're going to hang out with, just as we said earlier, and the face masking is still going to be appropriate. Other things you can do, of course, stay up to date with your doctor to make sure all your medical conditions are in tip-top shape. But it still goes back to the vaccine. The vaccine, to me, helps people get a playbook for their immune system, right? It's not a conversation about keeping your immune system strong, right? If the Ravens trained all week but had no idea who they were playing Sunday, they probably will lose that game, right? Your vaccine gives you that playbook. It tells you exactly how to fight this off. So I recognize people want to see other alternatives, but these are really the ones that have really stood out the best, right? The face masks, who you're going to hang out with, the vaccine, those are going to stay tried and true. So talk to your doctor to find potential other alternatives, but I promise you, I think these are the best that's still out there.
And I think people are often looking for like a magic bullet. And, what's been a blessing, a silver lining in the pandemic is the magic bullets are really simple things that any of us can implement. So a lot of times we want, fancy medication and all of those things. And, again, some of our, protective strategies are, quite simple: a mask, alcohol, hand sanitizer, all of those things. So, we don't need a lot of, a lot of magic bullets in a sense. We have to, we can really optimize and work with the ones that we currently have, the tools we have in our hands. And I think that was Dr. G's 5th analogy. I'm counting with you, Flo.
Yeah, I put the 5 up. I put the 5
okay.
up.
I was waiting for someone to comment on that.
I put the 5 up. But Kelson, your question has me actually thinking, have you been living life wrong the whole time?
Yeah.
I remember being young and you get to watch TV, and people in China, that was part of like their fashion thing, and we used to be like, yo, why are these people wearing masks? And then you fast forward, and it's like, it makes 100% sense.
Yeah. No, it's interesting. I've thought that too. And you were teasing me earlier about the chains. I mean, I got these on Amazon. I have 5 like colored beaded chains, and I coordinate them with the mask and what I'm wearing, to make it fun, because I was sort of thinking like you, I was like, golly, I don't think I'll ever get on an airplane again without a mask. Even if they tell me I can, I won't feel comfortable. I don't think I will ever feel comfortable doing that again in my lifetime, right? So there are some positive benefits that may become a part of what we do. Like my son doesn't know what it's like to go up to the gate and meet your family member getting off of an airplane, because he was just under the age of 2 when September 11th happened. So for him, it is completely normal to go to the airport, half undressed and all of that. He doesn't know anything differently. And if you think about it, we're going to have a generation of kids who are young now. This is going to become the norm for them. So there's certain things that, we're struggling about now that are going to be normalized for a whole generation that comes behind us.
Okay. So one thing I do want to normalize is getting tested. So of course, first couple questions, where do people get tested? How often should they be tested? And where the free test for people?
I mean, I know one of the questions I often get is, I was exposed to somebody, how should I go about thinking about getting a test? So one of the things is, it's very tempting. Oh no, I was exposed to somebody yesterday, I'm going to test right now. You should really wait about 3 to 5 days, see if you're symptomatic. And if you get symptoms, the moment symptoms onset, you should test. But if you don't have symptoms, then you want to maybe get tested at that 3 to 5 day mark, because it's going to take that long for there to be enough viral titer. So I say that to say, just so that we can really be efficient with the tests that we have. If you got the link to get the government, like the free at home test, you should absolutely sign up for and get those. Like those all came to our family members. I think you could sign up again.
I haven't got mine yet.
What's that? You haven't gotten it yet?
Mine yet? No.
Oh dear. Okay, because we got ours maybe like a month ago.
Wow.
So
it takes a while to get them though.
Yeah, it does take. Well, it takes several weeks. But a lot of the, some of the pharmacies in the community have the testing, but it may be there are different kinds of testing. So I don't know. Dr. Maragakis might want to talk a little bit more about the rapid test versus PCR, because there's often some confusion about which test.
Yeah, so the polymerase chain reaction, or PCR test, is sort of the gold standard. That's what gives you the most accurate results, and that is taking a sample from your nose, or the back of your nose, and that takes longer time to come back. So I was talking earlier about the rapid tests, and it's so useful to have results right away, but those are not quite as accurate as the PCR test. So if you have symptoms and you need to sort it out, the PCR is the best. But if you have need for an answer more quickly, there's something called an antigen test. And those are the ones that are, sometimes they take 15 or 20 minutes, sometimes even faster. And a lot of pharmacies have those. They're variable though. So different kinds give a different sensitivity or specificity, which is our way of grading the test and saying, how accurate is it? Is it going to tell you yes if you really do have the virus, or no if you really don't? And that's where it gets tricky, especially if you have very, very mild symptoms and you're trying to sort out whether it's allergies or COVID. That's when it's useful to take tests over, test a couple of days in a row to see what that is. And that's what's hard when we don't have wide availability of inexpensive rapid tests.
But a lot of, patient first and the pharmacies will have the tests available. So that those would be recommended places initially if you don't have the home tests.
Okay. Before we wrap up our Is the Pandemic Over talk, I do want to ask a big question about our favorite new accessory, the mask. Because there's, which mask is right? Can I wear a face shield? Do I have to wear what is it, the KN95?
Yeah, N95.
Yeah. What's the best? Is this surgical? Is this a surgical mask? Is this fine? What should we wear?
So I'll start, and then I'm sure we all have something to say about this, but I just want to start by saying the most important thing is to choose to wear one and to wear it properly, covering your nose and your mouth, and to wear it consistently. So I'm sure all of us have seen people with a mask on, but it's sort of hanging off of one ear or down below the chin. or my favorite is, that's not my favorite, is when they have it on and then they want to talk and pull it down and talk to somebody, which is defeating the purpose. So wearing it is the most important thing. And I say that because it's really a physical barrier that is containing any kind of little droplets from breathing, talking, coughing, and sneezing, of course, but even just talking to each other. And that's why even the cloth masks, and I know a lot of people have been out there saying cloth masks are worthless, and I disagree with that. If that is what works for you and is most comfortable and what you can wear, I wear a cloth mask all the time, except when I'm in the hospital taking care of patients. And I think that if it's well fitted and has double layer in particular, that a cloth mask is an excellent choice. But of course, there are other types of respirators that you've mentioned, N95s, KN95s, and you can choose something like that for a higher level of protection, but they have some downsides too. They're harder to wear. And if they're really fit very tightly, like the ones that we wear in healthcare, that can be very difficult to wear for a long period of time and difficult to breathe through them. So you have to choose something that you'll actually wear properly.
Yeah, I would agree with that. I would say that it's the proper wearing of whatever mask you have, double, triple layer with cloth. I also wear cloth most of the time, except when I'm in, the hospital or healthcare setting. The N95s, there are some of them that are fairly comfortable to use, but they're more expensive. So I think the other thing is we don't want to create economic barriers for people, because surgical masks, cloth masks are going to be less expensive. And if they're being worn correctly, they're going to be, equally effective. My favorite is when people have it like down under their nose. We went to like Baskin Robbins the other night and I was like, just give me my ice cream so I can leave. I just, because I didn't want to start like a whole public health messaging campaign in the Baskin Robbins. Like my family gets embarrassed by that, but it's the proper wearing, and it's preferably one with a wire so you can really get the seal, around your nose, and cheek and coming down over your mouth. But again, what we want is for people also not only something that's comfortable, but something that's affordable, because again, as you get to the level of the masks that are worn in the clinical setting, those will be more expensive. So we don't want that to be a barrier to proper protection.
Okay. Last thing before we go, because we only have a couple minutes, Dr. G, I think you need to do a YouTube channel, something where you do analogies with the actual situation, so people could. No, I'm being serious.
Let's do it. You and me. I'm happy to, man.
Something with Dr. G, with the analogies and stuff like that. But I have to ask the hardest question: will COVID go anywhere? Is COVID going away?
I'll tackle this. I don't think it'll go away. I think it'll become less disruptive to our lives. I think it'll be here as we learn to live with it. We may have some inconveniences here and there, but I don't think it'll go away in the near future.
Mm-hmm. Yeah, I agree. I think that if there's something called endemic, where this sort of like flu is like that, right? Where this is something we deal with. Mm-hmm. We know we get cycles of it, peaks of it at different times. We have effective vaccines. We work on developing more effective treatments, and not being afraid to go back to the key baseline prevention when we have a surge. That's sort of how I think many of us are starting to think about living our lives.
Okay, so is the pandemic over? Not yet, but you can do your part to make sure you can help end it. Wear your mask, hygiene. Have any more questions, you can log to hopkinsmedicine.org/coronavirus/equity. Dr. Golden, Dr. G, and Dr. Maragakis, thank you so much for taking time with us today to talk about the coronavirus.
Thanks for having us.